A digital press conference to give updates on COVID-19 and vaccination rollout in the Western Cape. For more on this, let's take you there live.
Sort of going or piling up one on top of each other, it really is starting to put pressure on the system, and we really do need to see an urgent outcome of the FDA and the USA on whether we can actually go ahead with the vaccine rollout of Johnson & Johnson. But of course, that is also putting pressure on our system. We are also, as you'll see in the Digicon today, announcing our our plan for mass vaccination sites. We have been mentioning it before, and I want to thank, first of all, the CTICC, the City of Cape Town, and our team, both at Public Works as well as at Health, on working together to get the first of our own mass vaccination sites, the processes right, the legal processes in place, and over the next few weeks we will be able to launch the first of those mass vaccination sites at the CTICC. And of course, this is going to be in line with, as we need to ramp up the number of vaccines as we move to the different age cohorts, 40 years to 49 years old. If we remember the volume of citizens that need to be registered in the 60 and above being 720,000 citizens. Of course, when we move to the 40 to 50 and the 50 to 60, those cohorts, the numbers are so much bigger. And of course, we're also dealing with people that are in jobs, that are working, and we need to have a bigger volume of vaccines rolling through the system every single week. So that's what we will be announcing today. And then I think my last point that I would like to just raise is in my own visits to the vaccination sites, and I'm sure Minister Mbomba after me will corroborate this because she's also been traveling around the province. But what really stands out for me in the site visits, but also I think in the social media messaging, in the email messaging, in the calls that I'm getting, and I'm picking it up across our call centers, etc., and of course the individuals that are in the room here as well. We're getting more and more messages from citizens saying, thank you very much. It was a really good experience. And for that, I must thank our frontline staff, to the healthcare professionals that are running our vaccination sites, to the volunteers from neighborhood watches and community volunteers who are helping as well, and to, of course, those organizations that have made sites available. I really want to thank you, because it is that experience that is what counts, and it shows that as a government, we're a caring government. One of our values, and you can feel it, it is lived through those frontline staff. And I want to say to you, thank you very much for what you're doing in helping us get the ramping up of vaccines and making sure that our citizens have a good experience while we're all trying to get past or through the management of COVID-19. And again, as we're moving into this third wave, it is becoming more and more important that we all play our part. So with that, I look forward to the presentation from Minister Mbomba and Dr. Cloete. And thank you once again for joining us. I hand it back to you, Kayla.
Thank you very much, Premier. So we'll now hand over to Dr. Cloete. Sorry, apologies. We'll now hand over to Minister Mbomba.
Thank you, Kayla. Thank you, Premier. Just to piggyback on what you have already said about the vaccination. When I look at the national database, so I was impressed actually to see what happened, for example, yesterday on the 9th, where actually we recorded the day where we had the most vaccination that happened in the Western Cape. And if you compare it, the last one I think was on the 2nd. Plus also in regard to, because I want also to congratulate those sites where they've done quite a lot in regard to the vaccination of the older persons. For example, for us, the Khayelitsha, the total of what has been vaccinated in Khayelitsha sites, I'm combining them, hospitals, site B, and Mitchell's Plain. Mitchell's Plain actually tops the list of the sites that have had quite a lot of the vaccination in total. And also, even with their daily vaccination, we find that there's quite an improvement. Of course, outside the metro as well, Oudtshoorn, yes, I've seen that you have vaccinated quite a large number, specifically yesterday in Paarl, TC Newman, and Vredenburg. Swartland, because I always want to make sure that we don't leave the outside the non-metro rural sites behind. Caledon, Ceres, Robertson, Swellendam, where they already now have started their vaccination in Worcester. Talking about that, in this week, I've been to other areas like Central Karoo, Laingsburg, in the Klein Swartberg farms, where in as much as that we might try to register as many people, but I don't think the inequalities that have been there throughout in South Africa will be able to be managed now instantly within regard to the vaccination drive. The fact is, we've got the area where there's no network. There's never been a network, and therefore no one has ever had phones in the first place. So how do we ensure to make point that those people also not only get registered, but also vaccinated? Because even as much as that we conducted some of them manually, thanks to my team and also to the team coming from the Central Karoo, from the Department of Health, but you find that it's going to take longer. Hence, it means that in some areas, we will have to make it a point that we do dual process and also to customize in order to be responsive to the conditions in that area. And in a week's time, I will also go to the Matsikama area where I know that there is nobody who's got a cell phone because there's never been a network. In some of the areas of the Cederberg, where it means now as a department, we must make sure that we register and vaccinate. This is beyond the walk-ins where we say that in some areas, if you registered but still waiting for your SMS, you could be able to go in, but taking into consideration that they might not prioritize you. But I'm talking about the areas where you find that actually they have no clue what we're talking about, because even with the health services, we bring them through the mobile. In some areas, only once a month, because some areas we find that there are about 6 people who are older persons. But the fact remains, they are humans, they also need to be vaccinated. Having said that, the system is open now for healthcare workers to be able to register. If you are registered with a professional body like South African Nursing Council, Health Professional Council, and all of those, and according to the national system, it will divert you, because most of the healthcare workers, they are the ones who are within their professional bodies, they are on medical aid, which will divert you to the nearest, probably private facility. But I need also to raise my concern about the private, where we find that they haven't utilize most of their sites when I look at the national system in regard to the Western Cape. For example, Mediclinic, according to the national database, they've got 12 of the sites that they indicated that there will be a vaccination site. But the last time I checked in regard to the figures throughout, it has only been the Cape Gate, Milnerton, Panorama, Vergenoegen that I saw that they've been active in regard to people vaccinated. Same with the Life Health Care, they've got 6 that they've identified in the Western Cape to have the vaccination sites. But when I saw there in the database, it was the Kingsbury. Similar with the Netcare, they've got 5, but only N1CT. But I want to thank the community pharmacy, where I've seen quite a lot of them from the Clicks, the Discam, and others where they've registered. I mean, they've vaccinated quite a lot. I think for us, we could be able to vaccinate more if we are all hands on the deck. And I'm excited the Premier is announcing that there will be mega sites that will be open. The larger sites, I think on Friday I'll be there, one at UWC. The larger sites already, they are about to function. And I'm also very pleased to see that the Metropolitan actually has done quite Momentum has done quite a lot of the vaccination during this period. So let's keep it there, make it a point that we vaccinate as many as we can. And for those who are unable to have an access, as government, not only as a Department of Health, because I'm talking about the areas where you need to work with the communities, with the municipalities, with the churches, in order to reach out and get to the bottom of those, the anti-SARAs who are unable to vaccinate and also to register, because with a third wave that is already on our doorstep, we don't want anyone needlessly and unnecessarily end up being infected or even having a severe illness because of such. So yes, we will do continue with the vaccination drive, and also where it's needed, we register and vaccinate as well, because we are needed throughout. Thank you. The HOD will do the presentation that will take us through in regard to where we are in terms of the indicators. And also we need to zoom and see what are the restrictions or recommendations that are being proposed in regard to various sub-districts in regard to where we are, whether we are in the yellow warning or the red warning in all of the province. But the last time I checked, we find that the province, actually almost all the sub-district and the sub-councils or substructures were affected. Thank you very much, Premier. Over to you, Dr. Cloete.
Thank you, Minister Mbombo. So we'll now hand over to Dr. Cloete to make his presentation.
Thank you very much, Kayla, and thank you to the Premier and the Minister. My presentation will follow the following sequence. I will look at the surveillance and the response update, then talk about the third wave, and then talk about the vaccine implementation. Just to update in terms of the cases and where we find ourselves with all the markers, we have been showing a very clear trend. The grey bars are the number of cases. We can see a first wave, we can see a second wave. And as the Premier said, the grey bars have now for 5 weeks in a row shown an upward trend and an acceleration over the last 2 weeks, which signals to us that we're entering a third wave. The markers are that hospitalizations are increasing, the oxygen use is increasing, the number of deaths reported is also starting to increase, and then very importantly, the proportion positive of cases that comes from laboratories have also increased. If you go to the reproduction number, we are at the reproduction number of 1.2. The easiest way to describe this is to say for every 10 active cases, we are now infecting 12 new cases. So the moment 10 cases gives you more than 10 cases, you are increasing. So at the moment, 10 cases are giving rise to 12 new cases. If your reproduction number is below 1, then your active cases, 10 new active cases give you less than 10 cases, you know that you're decreasing cases. So we are in an upward trajectory and a rapid increase over the last 10 days. This is the picture. So we've had a 31% increase week on week. But the most important thing we're saying is if you watch the graphic in the middle, 5 weeks ago, 4 weeks ago, 3 weeks ago, 2 weeks ago, last week, and now entering this week, you can see an acceleration. This is not a gradual increase, it's now an acceleration. That's why we are today saying we're entering a third wave. If you look at the bottom left, you will see also there's an acceleration on proportion positive cases going to the laboratory. It's now above 10% and holding above 10%. If you look in the middle, you can also see the proportion of hospitalizations increasing and now going steep. And as the Premier said, we've breached 1,000 hospitalizations for COVID yesterday. And on the right-hand side, the lag indicator, which is deaths per day, but that's also starting to go increase. So in summary, we're seeing more than 430 new diagnoses each day. Admissions are now more than 52 new admissions per day. And the deaths are between 5 and 6 new deaths per day. Proportion positive is now above 10%. It's 11.3%. If you go to the metro, 30% increase week on week. It is overall all sub-districts except in Khayelitsha. There's a clear increase in cases. And most of these cases are still diagnosed in the private sector. That's the brown bars. Blue bars is public sector. So it's been in the metro is very much driven by people that test in the public sector, in the private sector. And we also see that the increase in hospitalization in the metro is mainly in private hospitals as opposed to a slower increase in the public sector hospitals. If you go to rural, there's also an increase, a 32% increase week on week, but here it's more a combination of public and private across all the areas. And you'll see in every area there's an increase across rural. So entering the third wave, just to make the point for you, we had a first wave and a second wave. We're currently seeing more than 430 cases per day, and we continue to see this increase week on week. So the big issue is we currently have 5,800 active cases, so it's almost 6,000. That has increased by more than 1,400 from last week alone. So that is more than a 34% increase in active cases. So we officially announced that we're entering the third wave in the Western Cape because of this acceleration over the last 10 days. These are our surveillance notes, and this is where we keep like our finger on the pulse across the whole province. And what is highlighted in yellow shows pictures. It shows several widespread cluster events, very similar to what we had in November 2020 when we were on the steep acceleration in the second wave. There's several smaller school clusters, but it must be noted that transmission is not at the school. Transmissions are in the community setting, but the cases gathers at the school. And this is really imminent widespread community transmission. The signs are all there. We've been through it before, first wave and second wave. And what we need to do now is really have a very, very concerted effort to be able to try and flatten the curve, to avoid gatherings and a very strong adherence to mask wearing and social distancing. Our triangulation with wastewater, which is done by the MRC, the City of Cape Town, Brede Valley and Theewaterskloof. This is now a picture week on week, and we also track to see where the COVID in the wastewater is starting to pick up. And it's also showing in areas where the cases are increasing that we can see the increase in the wastewater across these areas. If we then go to the third wave, we specifically then have developed something called a trigger point warning system. We call it first, second, third, and fourth warning. And it goes from yellow to orange to light red and then to dark red. The idea is the more the cases increase, and you can see the markers on the right-hand side points to that. So if there's large increase in daily cases, if our test positivity is for more than for a week over a certain time, and then our hospital capacity starts increasing, you'll see a lot of this will start get bold and bold every time. And for each warning, we then translate that in what does that mean for what we should do collectively. So on that first warning level, the big recommendation is restriction of gatherings and travel. And it's basically to try and break the transmission of COVID. When we go to the second level, we will say the same thing. When we go to the third level, we go to the same thing. So what we're saying about the restrictions, it is on the left-hand side. It is that we need to break the cycle of people coming into contact with one another, potentially spreading COVID. We know enough about the science to know that COVID gets spread where people come into contact with one another. So it's gatherings of any nature, funerals, all of those, and also to stop potentially limit travel into high-risk areas because you bring COVID back into other areas and you spread COVID that way. So these are the specific public health recommendations that we are recommending in the Western Cape. We are saying that we should have a maximum of 50 people indoors, 100 people outdoors, and less than 50% of venue capacity. Now that's a little bit stricter than what is currently in the regulations, but that is what we're mitigating for because we believe if we do that, there's a chance of curbing transmission. This is our response. We have a 5-point response to the third wave. The big one, number one, community behavior. It's to stop the spread, and that's the gatherings. Second one is our surveillance and outbreak, where we keep an eye on this. It's now becoming more and more. The third one is we can still keep the COVID capacity in hospitals down as we do other health services. The fourth one is to maintain those other services. The fifth one is that we could vaccinate our healthcare staff to be able to cope with what's coming. When we go into this acceleration, what starts happening is our hospital capacity for COVID needs to increase, other services then needs to decrease. But at any given time, community behavior can still break the cycle. And our outbreak then and surveillance is more about finding the more vulnerable and supporting them. That's why we're also starting the vaccination with people over the age of 60, and it was healthcare workers. During this third wave, now we're saying healthcare staff has to do normal services, vaccinations, and they have to look after people that's ill with COVID. That's going to be quite a big pressure on healthcare personnel. So as the Premier said, last night we officially went over 1,000. So now we have 1,028 COVID patients in acute hospitals. And you'll see a big increase in the private sector because there's more than 500 people now in the private sector in hospitals as of last night. If you look at the public sector, our occupancies still varies between 94 and 68 across the various areas. And totally we have 7% of all public sector beds made up of COVID, but that's increasing. Hospital of Hope in Brackengate, which we can scale up with the trigger system. Now I have 42 patients. The other sites are waiting to be scaled on, to be brought online as the admissions triggers that. The mass fatality center has got 2 decedents and it's able to cope with first and second wave, and that's the same capacity we're maintaining. So this is our dashboard. So you can see now 7% of all the public sector cases are COVID, 80% occupancy. So you still see that we have a pressure of very full and busy public sector hospitals in the metro, and I will show later why that is still so. The oxygen use is something that we learned a lot about in the second wave. Our combined use is now 28 tons per day. The public sector alone is using 15.2 tons a day. That's compared to the 51 tons we used in the first week in January, which is the peak of the second wave. We've done quite a lot to help our oxygen carrying capacity in between waves, and we've worked with AFROX that they're going to bring additional capacity in if needed for the third wave. The reason why our hospitals in the metro is full, it's mainly driven by trauma, and you can see this picture. This is now at 17 emergency centers, all of them, well, not all of them in the metro, most of them in the metro. Over the last 4 weeks, we've seen a total of more than 9,000 trauma cases at these emergency centers. About 40 to 45% of them occurs on a Saturday and a Sunday, and there's a spillover into a Monday. And we also know that it's high at the beginning of the month and high at the end of the month. Half of this is due to interpersonal violence, and we know that these are preventable, hence the very, very strong focus on the safety recovery plan for the Western Cape government, together with all our partners, to really start curbing on interpersonal violence. Our planning for the third wave very much has been on getting staff for COVID, but also staff for vaccinations and using them interchangeably geographically. One of the things we track very carefully is what happens to the Western Cape government employees in terms of COVID. So this dashboard is updated every day. And this dashboard, you can see that we've had, out of our 34,000 people, 10,000 to date have had infections. 10,013 has recovered more than 98%. Unfortunately, we've lost 136 staff members in the Department of Health. But if you look at what happened in the last 4 months, you can see in March, 54 cases, April, 44, May, 98, because we started to see the increase, and also June, 29. It's significantly lower than what we had before. And that is all been down to the fact that healthcare workers have started being vaccinated during this period. So we can see now these active cases, more than 50. It's doctors 9, nurses 23, 26 other categories of staff. But a very important thing that we can track now is that 22,583 of the total staff establishment of Western Cape Government Health, which is 34,440, that means 66% of our staff have been vaccinated. We now know in the age groups, between 41 and 50, 70% of people have been vaccinated, over 50, 70%. In the younger age group, less. And we also know which categories of staff we've vaccinated more. But we also go by health facility. For instance, quite a lot of our facilities, more than 80% of the staff in those facilities have been vaccinated. And we can now track and monitor the impact of vaccinations on the risk exposure to people for getting COVID. That brings us to the vaccine implementation program. Our focus now is in phase 2 on the people older than 60 as the first priority group. We will start moving into essential workers, clients in congregate settings, but very important, the 40 to 59-year-old age group is the big volume age group that contributes to the 2.3 million people that we have to vaccinate in phase 2. And as just a reminder, phase 2 started on the 17th. There is still some healthcare workers. You can see we still need to up our healthcare worker vaccinations. But the big thing is we will transition from one age band to the next. So we'll go from 60, plus 60 to plus 50 to plus 40.
We're coming up out of that update on the Western Cape COVID-19 and vaccination rollout with Premier Alan Winde on COVID-19. The province's MEC for Health, Noma French Mbombo, giving an update on the vaccination process, saying yesterday was one of those days where the most vaccinations were administered. And then the head of health, Dr. Keith Cloete, giving surveillance and response updates, saying the third wave and implementation updates, also giving those, saying 31% increase week on week. For 5 weeks in a row, there's been an upward trend of infections, indicating that the province is indeed entering a third wave. He says for every 10 positive cases, we're infecting, 12 new cases come through. Several widespread cluster events, some in school clusters, but also clarifying that the school clusters does not mean that the infections are in the schools. It's related to school events that then have that unintended result. We'll try our best to take you back there, but for now, let's chase the top hour, the top of the next hour.